A lipoma is a soft lump made mostly of fat cells that grows underneath the skin. Doctors often call them fatty tumours, but lipomas are usually benign, which means they are not cancer. They commonly appear on the shoulders, back, arms, neck or thighs, and they usually grow very slowly. Many people live with lipomas for years without pain or serious problems. One interesting fact is that lipomas often feel rubbery or dough-like when touched. They can usually move slightly under the skin when pressed with a finger. Most lipomas are small, often only a few centimetres wide, but some can become much larger over time. Scientists still do not fully understand why they develop, although genetics appear to play a major role. Many people search online for a natural cure for lipomas, but it is important to separate facts from myths. At the moment, there is no scientifically proven food, herbs, vitamins, or natural therapy that can completely dissolve or cure a lipoma. Medical experts say that lifestyle changes may support overall body health and reduce inflammation, but they cannot guarantee that a lipoma will disappear. Claims that a single natural remedy can permanently remove lipomas are not supported by strong scientific evidence. That said, healthy lifestyle habits can still be extremely valuable for people who have lipomas. Eating a balanced diet rich in vegetables, fruits, whole grains, nuts, legumes, and healthy fats supports metabolism and overall tissue health. Foods rich in omega-3 fatty acids, such as salmon, sardines, walnuts, and flax seeds, may help lower inflammation in the body. Reducing heavily processed foods and excessive sugar intake may also support healthy fat metabolism. One of the most fascinating facts about body fat is that fat tissue is not just stored energy. Fat cells actually produce hormones and chemical signals that communicate with the immune system and other organs. Researchers now understand that excess inflammation in fat tissue can influence many health conditions, including diabetes and heart disease. However, lipomas behave differently from ordinary body fat and often remain even after major weight loss. Exercise is another important part of maintaining healthy fat metabolism. Regular physical activity improves blood circulation, insulin sensitivity, and the way the body processes fats and sugars. Strength training and aerobic exercise both help support long-term metabolic health. Even though exercise does not directly remove lipomas, staying physically active supports the body in many other important ways. Hydration also plays a surprisingly important role in overall health. Water helps the body transport nutrients, regulate temperature, and remove waste products through the kidneys and liver. Some people believe drinking extra water can flush out lipomas, but there is no medical evidence proving this. Still, proper hydration remains essential for healthy skin, connective tissue, and circulation. Sleep is another overlooked factor connected to metabolic health. During deep sleep, the body repairs tissues and regulates hormones involved in appetite and fat storage. Poor sleep can increase stress hormones such as cortisol, which may negatively affect metabolism over time. Getting consistent, high-quality sleep supports the body's natural repair systems. Stress may also affect the body more than many people realise. Chronic stress can influence hormone levels, appetite, inflammation, and fat storage patterns. Relaxation techniques such as walking, meditation, breathing exercises, or spending time outdoors may help lower stress levels. While stress reduction does not remove lipomas, it supports overall physical and mental well-being. Some alternative health websites recommend applying apple cider vinegar, castor oil, turmeric, or herbal creams directly onto lipomas. However, there is currently no strong scientific evidence showing that these treatments can safely shrink or eliminate lipomas. In some cases, irritating the skin with strong substances may even cause burns or inflammation. It is always safer to be cautious with unproven home remedies. Another important medical fact is that not every lump under the skin is a lipoma. Some lumps may be cysts, swollen lymph nodes, infections, or, in rare cases, cancerous tumours called liposarcomas. Liposarcomas are different from lipomas because they often grow faster, feel firmer, and may become painful. Any lump that changes rapidly, becomes hard, or causes pain should be checked by a healthcare professional. Doctors usually diagnose a lipoma with a physical examination. If a lump appears unusual, larger than expected, or located deeper in the body, imaging tests such as ultrasound or MRI scans may be recommended. Sometimes a biopsy is performed to examine tissue under a microscope. These tests help doctors make sure the growth is truly benign. Medical treatment for lipomas is usually only recommended if they become painful, restrict movement, grow quickly, or bother someone cosmetically. The most common medical treatment is surgical removal. During this procedure, the lipoma is cut out along with its capsule, which lowers the chance of it returning. Liposuction is another option sometimes used for larger fatty growths. A common misconception is that modern medicine only suppresses symptoms. In reality, surgery removes the lipoma itself rather than simply masking symptoms. At the same time, healthy habits such as nutritious eating, exercise, stress management, and sleep can support overall health and may improve how the body functions as a whole. A balanced approach that combines evidence-based medicine with healthy lifestyle choices is often the most reliable strategy. Scientists continue studying why lipomas form and whether metabolism, genetics, inflammation, or the microbiome may play a role. Some research suggests that inherited genetic changes strongly influence the development of multiple lipomas in certain families. This helps explain why some people develop many lipomas while others never develop any. The human body is still full of mysteries that researchers are working hard to understand. One especially interesting fact is that lipomas can sometimes remain stable for years without causing any issues at all. Many people never need treatment and simply monitor them over time. Because lipomas are usually harmless, doctors often recommend observation unless symptoms develop. This highlights the importance of proper diagnosis instead of fear or panic. The healthiest long-term strategy is focusing on overall body health instead of searching for miracle cures. A nutrient-rich diet, regular exercise, adequate sleep, hydration, stress reduction, and routine medical checkups all support the body's systems in powerful ways. These habits improve cardiovascular health, metabolism, immune function, and energy levels throughout the body. Even though no natural remedy has been scientifically proven to cure lipomas, healthy living remains one of the best ways to support long-term wellness. Medical experts also emphasize the importance of avoiding dangerous self-treatment methods. Trying to cut, inject, or aggressively squeeze a lipoma at home can lead to infection, bleeding, scarring, or nerve damage. Online videos promoting risky DIY removal methods may look simple, but they can be extremely unsafe. Safe medical care is always important when dealing with unexplained growths under the skin. Lipomas are a reminder that the human body is incredibly complex. A small lump under the skin may seem simple, but it involves fat cells, connective tissue, genetics, immune signals, and metabolism all working together. Researchers continue learning more every year about how fat tissue behaves inside the body. Understanding these medical facts helps people make informed decisions based on evidence rather than fear or misinformation.